Dr. Choll Kim here from sunny San Diego, California. Look at all this equipment we need to use for a little band-aid surgery. The smaller the incision, usually the more equipment you need. This is the wife of a pastor who has some back pain, but mainly pelvic dysesthesias. And here's what's challenging about this. Typically, we try to confirm that the annular tear is the cause of the symptoms. It's a prominent annular tear, look at that. Using targeted diagnostic injections, but unfortunately she did not have a diagnostic response, and she tried virtually everything else, and she continued to have symptoms. And really, after much deliberation, assessment by multiple different physicians, including one of the most famous urologists in the entire planet, Dr. Irwin Goldstein, we cannot think of anything else, and she's miserable. So we've decided to proceed with surgery, utilizing the most minimally invasive technique I have in my arsenal, and we're praying that it's going to make a difference. So wish me luck. Shoot, that looks like an obvious answer. Shot and save. Shot and save. There's definitely an annular tear. Here you go. Can I have the stylet back? Wow, this disc is completely incompetent. This disc is, I don't know what the medical term for it is, caca-poo-poo maybe? That's the empty 10 sign. It's already blue right there. And it's an unbelievable amount of inflammation. All this adherent epidural tissue should just float away because nerves are pulsating and they need to slide back and forth. If you don't think a stuck nerve is irritating, just put a piece of tape on your neck and see what you feel like at the end of the day. The skin underneath the tape will be so irritated. Unbelievable amounts of little blood vessels due to hyperemia. That's the fancy term for lots of blood vessels. And that's what happens when you have inflammation, lots of blood vessels. Without inflammation, your body would just never heal and it would be overwhelmed with infection. And this is my favorite instrument, I hate to say it, the laser. Just because I like saying the word laser, and then look how magical it is. It just makes things disappear. It's really precise. Okay, this is 4-5. There was an obvious annular tear all the way across with an empty cavity. I call that the empty 10 sign. But I think I got all the loose pieces. There's lots of epidural adhesions. That's a fancy way of saying things are stuck down due to scarring and inflammation. I release that. And essentially, this is starting a new healing reaction. So hopefully it will go down the correct healing path. Inflammation will turn on and turn off. This will fill with blood, then blood clot, then a provisional matrix, a scar, and then it'll become fibrocartilage. And most importantly, you'll feel a lot better. Because if you don't, who cares what else is happening?
You're okay.
Shot and save. That one has a clear annular tear, shot and save. Obvious, shot and save. Okay. Go pimple popping maneuver. There it is right there. It's like a reveal party. Look at that. There's the dural tube, that bluish thing right there with all the veins on it. Surrounded by fat because all major nerves are surrounded by fat. There's something blue right there, look at that. Same thing, this is all stuck down too. It's actually not as stuck down as 4-5. I'm so glad we did 4-5.
Yeah.
You never see blood vessels like that. Look at that. Look at that little blood vessel right up on top. Fill up. Isn't that wild? You can see so much better under an endoscope because it's magnified and it's continuous irrigation. Sort of like when you put on a mask underwater. It's like, oh wow, I can see so clearly.
Yeah.
Look at this tear here. But we knew that. It was so obvious on the MRI. It's still awesome. Lots of inflammation here too. Okay, so there was a big tear here. There's where it ends. It ends right there too. It was exactly where the MRI said it was. And there's lots of inflammation here too. So I am very hopeful that this is going to help your symptoms. Even though you had a negative diagnostic response, we're going to definitely pray that you get better. Because life is too short to be in pain. Surgery's all done. Now for the world's most expensive Band-Aid, but this is the nicest Band-Aid. I'm going to ask UCSD to start getting this. Look at how nice that is. It's smooth, it's cloth, it's got a little border. And by the way, the surgery went beautifully. And I found a lot of good pathologic stuff. So I'm feeling really optimistic for a great result. We're all praying for a speedy recovery, so best wishes.